Hello everyone, welcome back to the channel. If you're watching this video, there's a good chance you're over 60 or maybe caring for someone who is, and you want to stay healthy, active, and enjoy life to the fullest. That's exactly what we're here for. Today, we're diving into something that might surprise you. Itchy spots on your body, spots that might seem harmless at first, but could actually be early warning signs of more serious health issues. And for those of us over 60, catching these signs early can make all the difference in maintaining quality of life and even extending it. Now, before we begin, let me say this. I'm not a doctor, and this video isn't meant to replace professional medical advice. But I am sharing research-based information and insights from doctors that can help you recognize when an itch might be more than just dry skin or a mosquito bite. So, grab a cup of tea, get comfortable, and let's talk about 4 specific itchy spots on the body that may reveal serious health problems after age 60. Our first spot is one many older adults are familiar with: itchiness on the lower legs, especially around the shins and ankles. At first glance, this might seem like just another sign of aging dry skin, perhaps, or maybe standing too long or sitting with poor circulation. But here's the thing. Persistent itching in the lower legs can sometimes signal something deeper. One possible cause is poor circulation, often linked to conditions like peripheral artery disease, PAD. When blood flow is reduced, especially in the legs, the skin can become dry, thin, and irritated. This isn't just uncomfortable. It can lead to slow-healing sores or infections if left unchecked. Another concern is venous insufficiency, where the veins struggle to send blood back to the heart. This can cause fluid buildup under the skin, leading to swelling, discoloration, and yes, intense itching. And in some cases, leg itching has been associated with diabetes, particularly when nerve damage, neuropathy, begins to develop. High blood sugar levels over time can affect nerves throughout the body, including those in the legs and feet, causing tingling, numbness, or burning sensations, including itchiness. So, what should you do if you notice persistent itching in your lower legs? First, keep the area moisturized, but don't ignore it if it doesn't go away. Check for any changes in color, texture, or sensation. Are there any sores or swelling? Is the itching worse at night? If the answer is yes to any of these, it's time to call your doctor. These symptoms could point to a condition that needs attention, especially as we age and our bodies change. Stay tuned for part 2, where we'll cover the second itchy spot, the abdomen, and how it could be signaling liver or gallbladder issues. Until then, take care of yourselves and don't scratch that itch without checking it out. The liver and gallbladder play crucial roles in digestion and detoxifying your blood. When they start having trouble, your body may send signals, sometimes in surprising ways. One of those signals? Itching, particularly around the upper abdomen or sides. This kind of itch is often caused by a buildup of bile salts under the skin. Bile is produced by the liver and stored in the gallbladder. If there's a blockage, like from gallstones, liver disease, or even certain cancers, the bile can back up into the bloodstream and irritate the skin, causing intense itching without a rash. Now, this isn't always localized. It can spread to the palms, soles, or all over the body, but it often starts on the abdomen. And unlike regular itching, this one tends to get worse at night, which can disrupt sleep and leave you feeling run down. Another thing to watch for: Jaundice, a yellowing of the skin or eyes. That's another common symptom when the liver isn't working properly. But not everyone gets jaundice before the itching starts, so don't wait for that. Conditions like primary biliary cholangitis, gallstones, or even liver cancer have been linked to unexplained itching. And while these are serious conditions, early detection makes a world of difference, especially after 60, when recovery can take longer. So, what should you do if you notice unexplained itching on your abdomen? Start by ruling out the basics: new detergent, tight clothing, allergies. But if the itch persists for more than a week or two, especially if it's severe or worsening at night, talk to your doctor. They may want to run blood tests, including liver function tests, to check for underlying issues. Don't brush it off as just getting older. Your body is giving you a message. Listen to IT.IN Part 3. We'll look at the third itchy spot, the scalp and ears, and how itching there could be a sign of something bigger. Until then, stay curious about your body and keep asking questions. Your health matters. Let's start with the scalp. While occasional itching is normal, persistent or intense itching, especially if it doesn't respond to regular shampoos or treatments, can sometimes be a sign of something deeper. One condition to be aware of is psoriasis, which commonly appears on the scalp. Psoriasis causes red, scaly patches that can be very itchy and uncomfortable. Left untreated, it can lead to hair loss or secondary infections. But even more concerning is a condition called seborrheic dermatitis, which often looks like severe dandruff but can be linked to neurological conditions such as Parkinson's disease, which becomes more common after 60. Another possible cause: hormonal changes. As we age, hormone levels fluctuate, especially in women during and after menopause. This can affect oil production in the scalp, leading to dryness, flaking, and itching. And then there's diabetes again. High blood sugar levels can cause dry, itchy skin anywhere on the body, including the scalp. Plus, people with diabetes are more prone to fungal infections like ringworm, which can appear on the scalp and cause significant discomfort. Now let's talk about the ears. If your outer ear canal feels itchy, it might just be from water trapped after a shower or swim, or maybe your earbuds are irritating your skin. But when the itch is deep inside the ear, or it keeps coming back without explanation, it could be a sign of diabetic neuropathy, allergies, or even ear canal infections that need medical attention. There's also a rare but serious condition called malignant otitis externa, which affects older adults, especially those with diabetes or weakened immune systems. It starts with persistent ear pain and itching, and can spread to the bones and cartilage around the ear if left untreated. So what should you do? If you have chronic itching on your scalp or in your ears, especially if it's accompanied by redness, flaking, pain, or hearing changes, it's worth mentioning to your doctor. Don't assume it's just aging or poor hygiene. Treatments vary depending on the cause, from medicated shampoos to antifungal creams or even oral medications. And catching an underlying condition early can prevent complications later. In our next and final part, we'll cover the fourth itchy spot, your hands and feet, and why that kind of itch might mean more than just dry skin. Until then, take care of your head and don't ignore that nagging itch. So far, we've covered itching in the lower legs, which could signal circulation or nerve issues. Itching around the abdomen, possibly linked to liver or gallbladder concerns. and itching on the scalp and ears, which can be tied to conditions like psoriasis, diabetes, or even neurological changes. Now it's time for the final and perhaps most surprising itchy spot. Your hands and feet. You might think dry skin or eczema is to blame when your hands or feet itch. But for people over 60, persistent or unexplained itching in these areas can sometimes point to more serious internal health issues. Let's dive in. Itching in the hands and feet, especially without a rash, can be a symptom of nerve-related conditions, such as diabetic neuropathy or peripheral neuropathy. When nerves are damaged, often due to high blood sugar levels from diabetes, they can misfire and send abnormal signals to the brain, including sensations like tingling, numbness, burning, and yes, itching. This kind of itching tends to be worse at night and often affects both sides of the body symmetrically, like both hands or both feet. And because it's related to nerve damage, topical creams or lotions may not provide much relief. Another possible cause: liver or kidney disease. In advanced stages of these diseases, toxins can build up in the bloodstream and irritate the skin, often causing intense itching in the palms and soles. This is known medically as uremic pruritus in kidney disease and cholestatic pruritus in liver disease. What makes this type of itch especially tricky is that there may be no visible rash or irritation, just an overwhelming urge to scratch. There's also a condition called lichen planus, which can appear on the wrists, ankles, and inside of the mouth. Causes itchy, purplish bumps and can be linked to autoimmune responses or hepatitis C infection, both of which are more common in older adults. And let's not forget about shingles, which often starts with a burning or itching sensation before the telltale rash appears. Shingles is caused by the reactivation of the chickenpox virus, and the risk increases with age, especially after 60. If left untreated, shingles can lead to a painful complication called postherpetic neuralgia, where the pain lingers long after the rash clears. All right, friends, that brings us to the end of our 4-part series on itchy spots and what they might mean after age 60. Remember, not every itch is a sign of something serious, but some definitely are. Your body communicates in subtle ways, and paying attention can help you catch issues early when they're easier to treat. If you found this video helpful, please give it a thumbs up, share it with someone you care about, and don't forget to subscribe for more senior-focused health tips. Thank you for being here. Take care of yourself, stay curious, and keep listening to what your body is telling you. Until next time.